All right, it's officially 9:15 Central Time. Welcome to a conversation on contraception. I'm so excited. So, my name is Jennifer Bonner. I am a certified nurse midwife with over 15 years of nursing experience, and I love women's health. It's one of my absolute favorite things. So, after nursing school, I jumped into stroke ICU. I decided to go back to school to become a family practice nurse practitioner. And while I was in that rotation, obviously, I got to go spend some time with a women's health nurse practitioner. And I really ended up enjoying that opportunity to speak into women's lives and to walk with them through really exciting times, really hard times. And one of those things that really intrigued me was contraception. There are so many options, so much to talk about, and women have so many questions about it. And so this was one of my favorite things to study when I was in um, undergrad, grad school. And then once I graduated, I realized, you know what? I really do enjoy this area of nursing. And so I went back to become a certified nurse midwife. And so this was what I got to do for about 4 years of my career before I jumped into education. So I currently serve as the manager of nursing services here at Archer Review. And so a lot of what I do is private tutoring, webinars, I work with the live review. So if you've never seen that, you should definitely check it out. But that's enough about me. I want to know about you. How many of you are excited? Maybe you're a little nervous about this topic. Let me know in the chat. If you are joining us on Facebook or YouTube, you can let me know there as well. But I'm curious, how do you feel about the topic of contraception? Okay, I'm seeing some excited. I'm seeing some, okay, not so great. Well, wherever you fall on this continuum, this is really something that's good for us to understand. Now, I want to know how many of you are in nursing school right now? Not graduated, just how many of you are currently in nursing school? Anyone? You can use the raise your hand feature. You can let me know in the chat. If you are joining us on Instagram or TikTok, please go ahead, share, like, if you're joining us on YouTube, make sure you share with your friends, let them know, subscribe to our channel so you don't miss any of the opportunities to learn with us. So, a few of you are in nursing school. So, this is one that can kind of get a little bit tricky. And so, what we're going to do over our time together is we're going to talk about the major differences and the other types of options that there are. So before we get going, let's just do a little housekeeping. If you have a comment or maybe you're answering one of the questions that I have during our time together, I want you to go ahead and put that in the webinar chat if you're joining me on Zoom. If you're joining me on Facebook or YouTube, you can go ahead and leave those in the just the little chat box there. Totally fine. And same for Instagram and TikTok. So let me know, where are you joining me from? I am in rainy South Dakota today. It is honestly one of my favorite times of year because it's those days when you just want to grab a warm cup of coffee or a warm tea and sit by the window and watch it rain and with your favorite blanket, maybe have a movie at night where you're just kind of cozy. But I love to watch it rain. So I am in South Dakota. I'm seeing Texas. I'm seeing New York. Awesome. Canada. And yes, this is recorded. It will be on our Facebook and our YouTube channel for you to watch later if you'd like. Someone says I'm living in the hospital. Yes. Um, let's see, New York, Calgary, Canada. Awesome. So excited to have all of you on. Well, we have a short amount of time together, so let's go ahead and dive in. I want to first talk about our natural methods. Now, natural methods are ones that we're not using hormones. We're really not putting anything into the body. This is just being aware of how a woman's body works. And we call this the fertility awareness method. And so basically, what's going to happen is we're going to start tracking the cycle. We're going to start looking at different things like the basal body temperature, cervical mucus. Who can tell me, does anybody know what the cervical mucus does during those fertile days? Anybody know? There's a word for it that we talk about. What is the word for what we see during those fertile days? Yeah, it's egg white. So if you've ever, I love to eat some eggs for breakfast. And when I crack them in the pan, you have the yellow yolk right in the middle, but then you have this thick, this stretchy, very clear area as well. And we call that egg white, right? That's our egg whites. So that's what I want you to think about when you're thinking about fertile mucus is that egg whites. Yes, I can make that bigger for you. There you go. So that's what we see during those fertile periods. And basically what that does is it helps the sperm get to where they need to be. So typically, when women start to see that, they're going to avoid intercourse during those times. Now, this only works for typically women who have a reliable period. So, those who have irregular periods, maybe they're unexpected. This can be really difficult because with things like PCOS, polycystic ovarian syndrome, women don't always ovulate at the same time. So if you think about it, with a 28-day cycle, typically we're going to ovulate around day 14. But if we have those longer periods, we have those atypical periods, then we don't always know when that ovulation is going to occur. So the benefits with this is we're not putting anything in our body. There's no prescriptions to get, and it's very cheap. Typically, what's going to cost you is if you buy a basal body thermometer or you purchase an app to track these. But there's lots of free apps out there that can do the same thing. And so with this one, if you have irregular cycles or you're postpartum or breastfeeding, those are contraindications for the fertility awareness method because we know that you ovulate before your first period. And so women who just had a baby, we don't know when that ovulation is going to occur. Other things, we also have the withdrawal method. This one is fairly straightforward, but this takes a lot of and willingness on the partner's part. Okay. So this one does not protect against STDs, any ejaculate that makes it into the vagina. So our next form is our barrier methods. Now, I like to think about it because here in South Dakota, we like to joke that our state flower is the traffic cone because we have so much construction going on right now. And so when I think about our barrier methods, I think about those, the traffic cones, those barriers that say you can't come in. Over the summer, we made it to a couple MLB baseball games, and I noticed that after the game, there were a lot of barriers up, places where you couldn't drive anymore because there was so much traffic leaving the game. And so this is very similar to that, to traffic barriers. So we have the diaphragm and the cervical cap. So these are things that are placed inside the vagina and it basically protects the cervix. It puts a roadblock in front of the cervix. And we also use something called spermicide. Now, you don't have to use spermicide, but it does make it more effective. And what it does, that spermicide is there to basically kill the sperm. Okay. So depending on how these are used, you can see here we have our failure rates, but they are reusable. This is not something that I prescribed very often, but it was something that if a woman needed something non-hormonal and she couldn't track her periods, that she could use this. You can basically just wash it off, put it back in the case, and then use it the next time. This is something that can be placed before intercourse to allow for that spontaneity, but you do kind of have to think a little bit ahead of time. Okay. As far as using this, basically, we just need to talk about how to use it, talk to our client about, how to clean it, that type of thing, so they understand how to use it. So it's not put in incorrectly. And they do need to be fitted for this. So this is something that they would come in, they would make an appointment, we would fit them, order it, and then they would just have it. Again, because there is no um, protection, there's still skin to skin contact, fluid contact. This does not protect against STIs. So that's to be considered here. Somebody that's allergic to the material or the spermicide, if they're only allergic to the spermicide, they can still use the diaphragm or the cap. But if they're allergic to whatever the device is made of, they wouldn't be able to use this one. If they have had a recent childbirth or abortion, remember, we're not putting anything in the vagina there, or a pelvic organ prolapse, that can make this very difficult to use. Our next one is condoms. There's both male and female, and these are pretty straightforward. Most people understand these, but this is essentially a sheath that's placed over either the penis or put in the vaginal canal to create a barrier. Essentially, if you think about like when we go outside, we want to create a barrier from the rain. So this morning, my kiddos put on a raincoat, right? And so that protects them from what's coming outside, that protects them from the rain. Very similar here. And so essentially what's happening here is that sheath is going to collect the ejaculate if there is some. And so the benefits here, it's non-hormonal, it's readily available, fairly cheap, pretty easy to use, right? But there are some limitations. There are allergies and sensitivities. And I'm noticing that there are more options for those who are allergic to latex. There are some concerns when we store these. They need to be stored in a good temperature, not too hot, not too cold, and there is an expiration date. Now, there is a risk that they, even with proper use, that they could break. So it's not 100% effective. Now, why would somebody not be able to use these? Well, if their partner is unwilling, or if they have allergies to what the condom is made of. Okay, so any questions about those? Those are our major non-hormonal, non-invasive options. Any questions there before we move on to the next? Okay, I'm not seeing any so far. All right, very good. All right, well, let's move over to our hormonal methods. Now, hormonal methods can be progesterone, it can be progesterone and estrogen. So we're going to talk through these. The first one we're going to talk about are progesterone only pills. Now, what these do is they're basically going to thicken up that cervical mucus, right? And so when that cervical mucus is thick, it makes it really difficult for the sperm to get to where they want to go. Doesn't make it impossible, but it makes it really difficult. Now, these need to be taken at the same time every day. They have very little wiggle room. There are times when you are combined oral contraceptives and you have some wiggle room, like, oh, I forgot to take it an hour later. Let me go take it. These, we need to take them at the same time every day. Good benefits here are people that can't have estrogen can use these. It's safe for postpartum. So those who are breastfeeding are definitely able to use this one. And they can be taken in that breastfeeding period. We can also use these if somebody is having menstrual issues. So maybe they have a bleeding issue. Maybe they're having intermittent bleeding or irregular uterine bleeding. We can definitely use these to help as well. Now, limitations, again, we're not protecting anything from an STI, and it's kind of time sensitive. So what I recommend is, hey, set a timer on your phone so that you're taking them at the same time every day. If you're going to take them at 9 a.m., set a timer every day, 9 a.m. to take those pills. Okay. Now, contraindications. Obviously, if we are pregnant, we do not want to use an oral or an internal invasive form of birth control. If somebody has breast cancer, typically we are not going to use these, or if they have issues with their liver, because remember, most of our medications are being at least filtered through the liver, and it can be very difficult on the body. So those are our progesterone only. The other form of birth control pills that we see most commonly is our combined. Now, our combined hormonal contraceptives have both progesterone and estrogen in them. And with this one, we are suppressing ovulation, basically telling the ovaries, hey, go ahead, take a nap, you're good. Okay. And so we are preventing the release of that mature egg from the ovary. And so if we don't have a egg that's being released, then it can't be fertilized. Therefore, we do have a pregnancy. Now, also, these form of birth controls can thicken up or form a burrow can, and again, we talked about how if we have thick cervical mucus, it's really hard to swim through that. So it prevents the sperm from getting to where they want to go. Now, these they do need to be taken at around the same time every day, but there is a little more wiggle room compared to our progesterone only pills. These are really effective. They can also regulate the menstrual cycle. So, for women who have PCOS, polycystic ovarian syndrome, that aren't having periods, these can kind of regulate those for them so that they know when that period is coming. It's reversible. So, if they don't want to take it anymore, all they got to do is stop taking them. Now, somebody on Facebook is asking, what is major priority in suggesting a method? Well, we have to know what is it the client is looking for. Do they want something that's reversible? Do they want something that's long term? What are their risks? So if somebody is smoking, that's a contraindication for a combined hormonal contraceptive. If they have a history of blood clots, again, that's a contraindication. So we first need to know what is it that they're looking for, and then we need to know what's their history. Now, the one thing that's really neat about combined hormonal contraceptives is that we can use these for a lot of different reasons. We can use these to help people's mood. So several of the clients that I had come into the clinic would have things like PMS. And so these would help them around their menstrual cycle. All right. Other things, women who, let's say they're getting ready to get married and they're like, Jennifer, I don't know what to do. Like, I'm supposed to be on my period during my wedding. What do I do? Well, what we can do is we can actually have them continue taking the active pills. So in these packs of birth control, what you're going to have, let's see if I can draw this for you here. What we're going to have is you have 3 weeks. So let me make this a little bit bigger for you. Okay, so we have 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. And then the last week is going to be a different color. So it'll be 1, 2, 3, 4, 5, 6, 7. And it comes in a little package. So we'll draw a little box around this, like it's a little package here. And then every day they pop one of those pills out of the package and they take it. So these pills up here in these first 3 rows are active pills. They have both progesterone and estrogen in them. This last week is just a placebo. It's just that's where they're supposed to have their periods. So the active pills, we stop, the body has a period, and then we start the next pack. Well, if they're supposed to have their period right here, and this is where their wedding's going to be, then what I would tell them to do is, hey, okay, when you're done with this week, I want you to just jump into the next pack of active pills. So a lot of times we can even control kind of how the periods go in that way. Now, as side effects go, some women might have side effects like nausea, breast tenderness, headaches. Typically, this is more of a if you're a higher dosage. Typically, we don't see that with our lower dosage, but we see this more so in the initial months. They can have some breakthrough bleeding during those times, but usually that will just kind of shake out in the long run. Typically, that'll go away once the body gets used to what this looks like. All right. Now, the next one is the birth control patch. Now, this is just like it sounds. It's a patch that goes on the skin, and this has both progesterone and estrogen in it. And so, what they do is they put the patch on, they wear it for a week at a time. So, they put on a patch once a week for 3 weeks. They go without a patch for that fourth week, and then they have a period during that time. So, it's essentially stimulating what we just talked about with the birth control pills. This is really effective, but we do see sometimes where there are batches that they don't adhere to the skin very well. And if they're not adhering to the skin very well, then we have an issue, right? They're not getting what they need, and we can see some issues with that. So it's not going to be working. Um, with this one, it's really convenient. They're not having to remember to take something every day, which is really nice. They just have to remember once a week. Limitations, sometimes people do have some reactions to the adhesive on their skin. It doesn't protect about against STIs, um, which is, something to be considering. So some people will use birth control patch, but they'll also use condoms as well. Again, anything that applies to the combined hormonal contraceptives, if they can't have estrogen and progesterone, then they can't have this either. So if they have a history of blood clots, if they're smoking and they're over 5, migraines with auras, again, if they're pregnant, we do not want them taking these. The vaginal ring. This is one of my favorites, actually. And so basically what it is it's a ring like you see here. Whoops, right here. And it's flexible. So what we do is we pinch it on the side. So just like this here, and it inserts in the vagina, and then it releases kind of like a hula hoop. And it releases those low doses of estrogen and progesterone, and that's absorbed into the body. And that's what's suppressing our ovulation and thickening up that cervical mucus. Okay. So this one we insert for 3 weeks, we take it out for a week, we have a period, and we start all over. So it's a little more longer term of the options that we've discussed so far. I have not heard of anyone having a sensitivity to these, but occasionally there are some issues. Again, it doesn't protect against STIs, and same thing applies. If you can't have hormonal contraceptives, then you can't use these either. The birth control shot. This is a progesterone only, and it is injected. So it's an IM injection every 3 months. And so it's, again, suppressing that ovulation, thickening up that cervical mucus. This is great for people who want a longer term option, but don't want the invasiveness of an IUD or a Nexplanon. People can't see it, so they don't even know that they're on it. Now, most of the time with this, I do see breakthrough bleeding. I see that irregular, unpredictable bleeding. They do have to come in to get that injection. And if somebody decides that they want to get pregnant, typically there is a delay in that return of fertility there. I do typically see some weight gain on this as well, to the point where people are like, you know what, this is not worth it. Give me something else. All right. So finally, we have just a few minutes left. We're going to talk about our longer term options. So, our long term reversible contraception. The first one we're going to talk about is the Nexplanon. Now, the Nexplanon is a small rod, just like you see here, inserted underneath the skin in the forearm. And so, what it does is it's releasing progesterone. This is a progesterone only option, and we inject it underneath the skin of the arm, and it's going to release that hormone over this 3-year period. Okay, so typically we see that this is effective for 3 to 5 years before it needs to be taken out. Once it's in, it's in. So there's really no perfect compared to typical use. It's just there. So it's effective. It works for a long time. So people aren't having to remember a bunch of dates. They just have to remember when it needs to be replaced. It's discreet. So most of the time, people don't even know it's there. Typically, it'll be covered by a shirt. And then if they don't like it, we can just schedule an appointment to take that out. So this is good for people who want a long-term option. They don't like the idea of an IUD, but they can't have estrogen. They could try this one. The limitations is that we do kind of have to do a small surgical procedure in office. We have to make us an incision, go find it, take it out. It doesn't protect against STIs. And we can see sometimes we see periods that go completely away. Other times we see that unexpected irregular bleeding. And it can be expensive, especially if insurance doesn't cover it. Now, again, if somebody is pregnant, we do not want them taking this if they have just kind of irregular vaginal bleeding that could be caused by something else. Sometimes we will use this to help with vaginal bleeding, but we want to make sure that we know what else is going on with that client before we do it. Now we've made it to our IUDs. We have hormonal IUDs that have progesterone in them. So these are things like the Mirena, the Skyla, the Kylena. And this is a little device that looks just like this, honestly. It's just a bit smaller. And it is inserted into the uterus during an office procedure, and it sits up in the uterus. So let me kind of draw for you what this might look like. So if this is the uterus here, let's say this is the uterus, it kind of sits up at the top, just like that. Okay, so the uterus is kind of an upside down pear. So it just kind of hangs out at the top, and then it has strings that go down into the vagina. Okay, so this is really effective. Again, progesterone only good for 3 to 5 years. A lot of times we see periods that go completely away on this. Other times we can see some irregular, unpredictable bleeding, maybe for the first couple months, and then a lot of times periods will um, go away. Okay, so these do release that progesterone only. But women tend to do really well with this. Now, limitations, again, does not protect against STI. We can have those menstrual changes. If we are unable to place the IUD, maybe because of anatomical issues, like they have maybe a fibroid in the way or a bicornate uterus, that's where the uterus is separated by a septum, then we can't do this. If they are pregnant, obviously, we do not want to place an IUD, or if they are sensitive to that type of hormone. Now, the other one is our non hormonal form of birth control. This is our Paragard. It's a copper IUD. Same, it looks the same. It just has copper on it instead, but it's still the same general shape. We place it the same way. We push it up to the top of the uterus, strings fall down through the cervix into the vagina, and we have our clients checking those strings, because if the strings are getting longer, that means that the body's trying to expel it. Okay. And so then it's not going to be effective. But this basically roughs up the uterine lining. It makes it a hostile environment for sperm to go through. It makes it a hostile environment for implantation. With this type of birth control, we see more heavier, painful periods, but a lot of women like it because it's long term. It's good for up to 10 years. Um, and there's no hormones to deal with. So it is really effective. It's hormone free. Typically, we don't see any side effects, and it can be used when someone is breastfeeding. Now, what's the limitations? Well, the procedure is kind of uncomfortable. It is not something that's fun to do, especially if you've never had a baby before, if that cervix has never been dilated. It does not protect against STIs, and it can be expensive. And again, the same applies for if we get that IUD up to where it needs to be, then we can't place this. If you have a bicornate uterus, things like that. If there's a pelvic infection, it's not recommended to place these either. So those are our major forms of birth control. Obviously, we also have tubal ligation and vasectomy, but these are the most common that we see. Okay, struggling. I need some more help. I'm not really sure. I'm trying to pass the NCLEX and I don't know where to go. Let me tell you about our Sure Pass combo. Y'all, this is amazing. It includes everything from our on-demand videos to our 3-day live review. If you're struggling with birth control, if you're struggling with the difference between placenta previa and placental abruption, we have a video for that that's going to slow things down, give you more attention to those areas to help you understand them. So we have the on-demand videos, the Q Bank, and then our 3-day live, which is occurs once a month. It's 3 days of live content where we go through the most high yield information in the various subjects that you're going to need to know to be successful on your NCLEX. So if you're an RN, I want you to scan this code over here. That'll take you there. PNs over here on the right. That will get you there. And we have reached the end of our time. Thank you so much for joining me. I know this is a difficult topic. I know that it can be a lot to remember, but remember, here at Archer Review, we're a family and we are here to walk with you across the nursing lifespan, whether you're just getting into nursing school, Maybe you're thinking about applying, maybe you're getting ready for the NCLEX, or maybe you're an advanced practice provider and you're getting ready to take your boards. We're here for you. We have a community for you. Thank you so much for joining us. We look forward to seeing you back next week for our next free webinar. Take care, everyone. Have a great day.